Welcome back. Welcome back to another episode of Behind Beliefs and Behaviors. And you know who I am. I'm Dr. Maisha, and we're going to have a very interesting conversation. And I'm going to tell you, we're going to have a conversation where I'm going to be learning just as much as you all, because I'm here with my sister, Dr. Erkeda DeRouen, and she is the CEO of Digital Risk Compliance Solutions. And we're going to be talking about digital health. And what is it, a risky business or is it not? And if you are a patient listening to this, is just as important for you to know about as well, because you need to be able to advocate and understand. And we're all about that health literacy as well. So whether you are a healthcare professional, healthcare provider, physician, or whether you are on the patient side of it, this is going to be a great conversation. Dr. Arkita, welcome to the show.
Thank you so much for having me. I'm so excited to be here, and I know we are going to have a lot to dive into. And I love that your audience is diverse because digital health is for everyone. So, yes, it's helping patients, number one,
Mhm.
come into play with taking charge of their health and their wellness.
That's right.
And I'm sure we'll talk about how you can navigate that better and advocate for yourself.
Mhm.
And for those who are on the healthcare side, it's giving us more power to reach more people and
Mhm.
to create more solutions quicker so that we can
Mhm.
help do the things that we set out to do in terms of helping people.
Yeah, yes. And so you do this work a lot with organizations. And I'd love for you to give our audience a little bit of background, like, tell us a little bit more about you and how you came into the space and how you have built this company.
Well, that would take us an hour, but I'll try to make myself succinct.
Highlights.
You guys will see that I'm very chatty. I love people, so
Yes.
yeah. So I'll start in the beginning. So I have always had a love for science, I would say, and for people. And when I
Mhm.
was younger, I was drawn to that in the more traditional sense for people who end up becoming physicians, where
Mhm.
they're curious and they're looking into those things. So, but I ran my mouth. So my family would say, "Oh, she's probably going to be a news reporter." But there were pictures when I was like 3, like with little doctor kits and things.
Yeah.
And that just grew over time where my grandmother had diabetes. I was the only one brave enough to assist her with giving her insulin shots and all the things. So when I eventually went to medical school, I was very sure that I would be a typical primary care doctor working in community health for 30 years or so, like with my people, underserved community medicine.
Mhm.
And that's still true to a certain extent. I did go down the path where I am a family medicine physician. I also have board certifications in lifestyle and diversity medicine. So it's very important for me as I approach different things, even now in digital health, to think about how it affects communities and how it
Mm.
affects people who are marginalized and historically underserved.
Yeah.
So I ended up working in a federally qualified health center, or community health center, maybe a more common term for people. And
Mhm.
I loved it. It was so wonderful. The patients were
Mm.
amazing. 50% of my patients were non English speaking,
Mhm.
uninsured, undocumented,
Mhm.
LGBT. So it was a very great population to deal with. But I noticed that while I was trained to know how to quote unquote fix or help aid in the
Mhm.
disease processes that they were going through, there
Mhm.
was all this other like administrative things where, for instance, some of you have a TEDx that came out a while ago where I talked about, it's called like, did Disney just save healthcare? Imagine that. Did Disney just save healthcare? Imagine that. And
Right.
it talks about like how we can utilize these innovations and work collaboratively, just like Imagineers and Disney do, where you're not necessarily in that field, but you can contribute to it to create
Mhm.
change. And I would love for us to create change in the underserved community. So it talks about in there a patient I had who, lovely gentleman in his 50s, ended up having some kidney disease, went on to be diagnosed with kidney failure and needed dialysis.
Mhm.
And most people who are listening, if that, heaven forbid, happened to you or a family member, you would be like, okay, well, let's get an appointment with a kidney doctor. So it wasn't that easy for him just because of the way that our system works. So we were able to get him some discounted care to see the kidney doctor, but no dialysis center would take him because he didn't
Mm,
have insurance. So
mm.
he had to go to the emergency room every 3 days just to live.
Oh,
And that's not right. So I love now that there are different agencies and things coming together to work to reimagine these things.
mhm,
There are even digital health companies that focus on kidney care to help
mm,
people get the care they need.
yeah.
But in that process of still talking about my journey, I ended up getting voluntold as a young doctor to represent our organization in all 5 clinics for unionization efforts that we were having.
Oh,
And it was an eye-opening experience because I was working on the side of the union and
mhm,
collaborating with the wonderful administrative team.
mhm.
This was an 18-month process with like lawyers and meetings every week.
Yeah.
I got thrown into leadership and
Mhm,
I enjoyed it. So I love seeing my patients, but I also love that part of like how can we make clinics work better? How can we
mhm,
help decrease the burnout for certain
mhm,
doctors and things like
mhm,
that, clinicians. So after I finished that experience, I was looking for something different and I heard about telehealth. And I had never explored it before, but I kept hearing about it. I decided to take a leap of faith and I joined a digital health organization before the pandemic, before anyone heard about it, before it was,
mhm.
and everyone was like, is this real? Will you be able to make a living? And I joined it. I ended up becoming one of their associate medical directors. I ended up working closely with the product development team and learning how you make a product out of an idea in navigating that space. And then working for different organizations, I ended up starting to consult because I'm chatty. I had started originally with little LinkedIn messages and talking to people, and I would see their ideas would actually make money, and they weren't paying me to do this. So I was like,
Mhm.
I should charge.
Yes,
So from
indeed.
I've worked at several agencies in terms of either being a consultant or being a fractional chief medical officer and things like
Mhm.
that. And I have also worked to develop my own app to help promote health equity called the Pacemakers, based off of my TED, where it helps build community, helps educate people on the questions that they may have for their doctor or be too afraid to ask or need to know where to start,
Yeah,
as well as learn how to advocate for themselves. And when I was working through these other organizations, there was a common thread that I noticed in terms of why we do the things we do. I think
mhm.
clinically, a lot of times, doctors, nurse practitioners, and other members of the care team, we do it because we want patients to get better. We do it because, okay, this is what we've learned and this is how we'll help. And organizations also do it that way, but
Right.
we do it in a different method, or we
Mhm,
have different intentions due to costs and due to all of the other factors that are causing pressure on executives. So
mhm.
I noticed that digital health is a risky business and we need to focus more on the risk management aspect of it. And
Yeah,
not only just because we're scared or we want to check boxes, because it shouldn't be a thing about checklists,
right.
but because we need to navigate creating technological advances responsibly so that we can
Mhm.
help people. So now I'm still a family doctor. I still am helping the community, but even from a higher level because we can
Yeah.
help so many zip codes and so many people and help them evolve.
That's amazing. I love your journey. And it is one of those things where, and I think there's a lot to be learned just in the journey itself. Like,
Mhm.
oftentimes, when you said, I thought I was going to be, a family doctor and working in the community for 30 years, like that was my story as well. And we can find a lot of commonality in our stories.
Mhm.
And as we evolve and take a little bit of risk and explore, then we discover that we love other things. And then we start to just dive in. And I love that you were, in a way, a little bit of a trailblazer. Like, you were in telehealth before it was popular, right? Before it was really known and where people were like, and I remember those times.
Mhm.
And so it's a lot to be said about having the kind of curiosity and then willingness to explore those curiosities inside of the career. And then how you parlay that curiosity and maintaining like your core values of helping community and like equity and like diversity and inclusion, all of those things into digital health, into making sure that everyone gets equitable care. And I just think that's a really beautiful journey and how you've parlayed that. Yeah. For those who may not be clear by now, digital health and telemedicine, are they the same thing? Can you just talk a little bit about what you mean specifically when you're speaking about digital health?
So that's a great question. I think it comes up a lot because there are a lot of nuances in terminology.
Mhm.
So digital health just encompasses like all of the technological innovations that you can use to help promote wellness and promote health and hopefully improve outcomes. So
Mhm.
that can be things like telehealth, which is even bigger than telemedicine because telemedicine is when you're getting care from your doctor utilizing
Mhm.
technology, whether or not that's through something like a Zoom, like a video, something
Mhm.
like a telephone, or
Mhm.
even text messaging. So there are many
Mhm.
modalities that you can use. You can
Mhm.
also have that in terms of like when someone is observing you when you're in the ICU remotely in like rural
Mm.
areas and other things
Yeah.
like that. So there are so many
Right.
interventions you can use with telemedicine.
Wow.
Telehealth is an expansion of that because it encompasses more than just a clinical setting in terms of like a doctor and a patient or a nurse practitioner and a patient type thing. It also encompasses things like teledentistry, like who
Yeah.
doesn't like get our teeth looked at online?
What?
It has telemental health. So a lot of people are utilizing that where there's
Mhm.
therapists and things online and it's opening and expanding care. So there are so many different things with that.
Yeah.
Digital health has even more than that. So it's under that umbrella. So the things like your wearable devices, where
Oh,
you're
yeah.
using your Apple Watch to track your health, you're utilizing certain apps and things like that to track your periods and your menstrual
Yeah. Yeah.
cycles,
Okay.
all of that is a part of your healthcare, even working in terms of like clinical trials and how they're pushing those forward digitally, where you can work with that, or when
Yeah.
they have precision medicine, where they're trying to figure out what kind of medicines are right for you. So
Right.
it's just like utilizing and implementing technological innovations to help improve health.
Wow. I told y'all I was gonna be learning stuff along with you because I didn't realize the level to which maybe even I don't understand the expansiveness of digital health. And I have a ton of apps on my phone, like food tracking and period tracking, and my Fitbit is connected to my phone, a wearable, and so it is really interesting to be able to distinguish the terminology. And so I would love to dig into like, what are some of the myths around digital health, because I do think that, especially with this expansive definition, that there's probably plenty of myths, both on the patient side and on the organizational side. And I'd love to hear a little bit of both. What are some of the myths that you hear and that you deal with, especially when you're with organizations?
I think one myth we can start with the patients. And
Mhm,
this happens, I think, throughout healthcare in general.
mhm.
We have an issue with communication
Yeah.
in collaboration in terms
Mm,
of sharing information.
mhm.
So a lot of times in the office, you may be annoyed. I know I'm like, why don't we have a universal system? When you go
Mhm.
in and the doctor's like, okay, so what happened at the other doctor when you went to the urgent care? And they're like, it's not in my chart. So
Right.
the bigger thing with digital health that may be a misconception, and I think that this can help us think through how we approach this,
Mhm,
is there are digital health or digitally enabled organizations that
mhm,
may be associated with your primary care office or your
mhm.
urgent care, where you may be able to go to a visit. They already have your information in there. They're able to kind of know a little bit about you, even if you're not seeing your clinician that you normally see, versus going to some of the startups or healthcare digital health organizations that are not affiliated with any organization or your doctor. We
Right.
don't share records, so they don't know anything about you.
Yeah.
So it may some tips to help you remain safe as you're utilizing these products because they can be very helpful. There are organizations that are helping people lose weight and gain their health back in their life. There are organizations where you're doing your mental health and all of those,
Mhm,
but it's
mhm.
about prepping yourself for the visit So I think that is very important in this digital time where you can have everything. You don't have to have all these lists to look for. Put it in your phone, use an app.
Right.
If you're not able to do that, write down your medicines, what
Mhm.
medical conditions you have, key points about how you want to describe what's going on, because it
Mhm.
will really give them a big picture about what's going on with you so that
Mhm.
you'll be able to get the best care that they're able to provide because they're really just going off of you. So you
Yeah.
gotta set them up for proper ways to evaluate you. I
Yeah.
talk a lot about that in a book that may be helpful for those who are looking in terms, especially women, on how to navigate their health. A big group of physicians came together with the Mayo Clinic, and we have a book come out that's called Taking Care of You.
Mhm.
It goes through so many different systems in terms of how can you advocate for yourself, what questions to ask, if you have arthritis, if you have migraines. So my chapter is talking about telehealth, can navigate that responsibly and go through and how you think about the questions or how you even frame how you speak with the person
Mhm.
who's taking care of you in order to get the best care that you deserve.
Love that. Love it. So we'll have that link for that book in the show notes, you all, along with a whole bunch of other links I'm going to tell you about towards in the show. We're going to have all the links to be able to get in touch with Dr. Akita. We're going to have all the links for socials and all that stuff. But for specifically for now, we make sure we include that link for the book because I think that's very important. So what else? What are some of the myths that you deal with from the health organization side?
I think there are a lot of myths in the healthcare organization, and I love to think about it in different buckets.
Mhm.
So, healthcare right now, I think that we're at that point where we had been trying to do what we always did, but just online because of the pandemic.
Mhm.
So,
Mhm.
in traditional healthcare organizations, we had no choice when the pandemic started. If we needed to see some patients, we were going to throw them on a Zoom.
Right.
And there's so much more you can do in order to successfully create ways in which you can care for patients than just putting them on a Zoom and taking notes just like they were in the office. There are
Right.
more ways to connect. There are many more ways that you can educate. There are ways you
Mhm.
can meet people where they are and have a holistic journey for them. It's actually even better because
Mm.
you had different ways in which you could present patient information or education. I
Mhm.
know for those who are listening, when you go to your doctor's office, more than likely they'll give you a printout at the end. It's in all of these words you don't understand.
Yeah.
They've never asked you, like, you could be a lawyer listening to this. That doesn't necessarily mean you know what your cardiologist wrote. When you get it, you look at it, you say, "This is gibberish," you put it in the trash on the way out.
Right.
Or they email it to you because they're digitally enabled. You could have multiple modalities. You could tell them what your learning style was. They could put it
Mhm.
at your grade level of reading and put it in layman's terms and send it to you
Yeah.
along with some YouTube videos and education.
Mhm.
And they could check on you and kind of check on you 3 days later and say, "Hey, can you write back what you understood from that visit?" Because sometimes
Mhm.
it's a lot to process, even
Mhm.
when you're getting a new diagnosis, or you may feel overwhelmed, or you may have questions. So instead
Mhm.
of just utilizing your portal to say, "Hey, I need a refill," or "When's my next appointment?" What if it actually cared for you throughout your lifespan outside of your appointments? So there
Mm.
are so many different ways that I think that healthcare executives and people who are making decisions can utilize tech that they may not be necessarily using to their best advantage because they are
Mhm.
just checking a box saying, "Yes, we offer digital health like everyone else." Another thing, and this kind of goes in the startup realm, one misconception is that we can skip steps because we're patient centric, but being
Mm.
patient centric doesn't always mean that you do what the patient prefers because they may not be trained on what is safe. For
Yeah.
instance, some organizations may say that patients like quick, which is true. You want to be in and out, you paid your money, all of the
Mhm.
things.
Mhm.
But when it's time to check in, they may have told you every medication they were on 3 months ago.
Mm.
They come back in, the decision makers at the startup may say, "Oh, we don't have to ask them their medication list because they told us on the first visit.
Yeah.
It'll take time. We don't need to do it."
Mm.
But from a safety perspective, you may have got a new diagnosis and went to a
Mhm.
specialist. You may have gone to the urgent care or in the emergency room. You
Mhm.
may have a new allergy. So we have to ask each visit, and everything can't just be convenient, it has to be safe. So
Yes.
thinking through things in a process of not just what's easier or faster or the lowest hanging fruit to do what you have to do to get by or to check the list, but to
Mhm.
do what is right for the patient is so
Mhm.
important.
Yeah.
And I think the third misconception going along with that from startups and healthcare organizations is that there are no lawsuits in digital health.
Ooh.
Organizations I had worked with in the past where you're like, "Oh, no, that's a little, I don't know." And they'd be like, "Oh, there have been no lawsuits with us. They don't look at us." And I know that we are seeing now that there is a lot of scrutiny coming
Mhm.
forward on digital health and digital health organizations. And
Mhm.
President Biden this year released the AI governance, innovation, and risk management policy that will be enacted for all federal agencies, including those like HHS and Medicare and Medicaid, and all of the companies who are overseeing healthcare. So it's going to trickle down.
Yep.
Specific guidances as to what they have to do,
Yeah.
what people they have to hire, like chief AI officers. There's pluses and minuses as to whether or not they need to do that, but also what you can do when you're using tech enabled things. Like
Mhm.
there's more than just chat GPT
Yeah.
for everything, but how you use it, and you have to justify that it doesn't impact patient like safety. So this is really exciting for us because it will definitely prioritize quality in the
Yeah.
tools that we use and try to make sure that we're not impacting civil rights or bias or equity. So
Yeah.
it's an exciting time.
That is exciting. It's interesting. One of the things that was coming up as you were talking about the myths with healthcare organizations, and particularly the skipping steps and the what was the first what was the there was this what was the second one that you said?
About there are no lawsuits in
So
digital,
there's no the skipping st- oh the lo- so there was the no lawsuits, the skipping steps, and the first one was
to
around
navigate approaching a visit in digital
how
health.
you how you approach a visit. So one of the things that came up was around this communication piece, this communication and collaboration. And what I loved about what you said was this piece of healthcare looking at digital health in a way that takes care of the patient outside appointment and asking a patient what their learning style is and delivering their post-care notes or their post-care summary according to that. And then you said earlier, you're talking about the collaboration and the sharing information. It makes me think about this whole idea of how in order to be able to think of things like this, we have to expand our own belief system, our own capacity to communicate. Because let's face it, we don't communicate like that. We don't take care of each other just in person to person. The work that I do, just understanding that people have different learning styles is a gap. It's a huge gap. And I'm often talking about how, well, some people are more visual learners and some people are more like they have to walk through it, and some people are more auditory learners. And you can't assume that the picture in your mind of what you're communicating shows up as the same picture in the person's mind. And the fact that digital health could be a potential bridge to that gap is very exciting. And it does also amplify the work that needs to be done in the personal development domain with healthcare providers and executives.
Absolutely. There's so much hope, especially even with language. Put it as a little more like black and white, like you speak English or not. Do you need an interpreter or not? But
Right,
not your preferred language. Yes, you may be able
right.
to speak English, but maybe you think like in your
And
native language,
and
or
you're
maybe
right,
you,
yeah.
you read better when you're reading it that way, or
Mhm,
maybe there are nuances in the way
mhm.
that we say things in different languages. There are some words that don't exist in other languages that exist in English and vice versa. So
Yeah,
are we even getting the point across? Because I think that a lot of times healthcare workers are very quick to say that someone is non-compliant or they're not listening or they're not doing this, and a lot of finger pointing and
Mhm.
we'll say, "Hey, you have diabetes, your A1C is 10, that's bad. Change your diet. Here's a sheet of what to eat. I'll see you in 3 months and take it again." And when they
Right,
come back and it's the same, you're like, "Oh, they don't wanna take care of themselves." There's
right.
so much that we can do to impact people in between, leverage technology to do that. I think that there is a lot of fear. This is another misconception with the utilization of, for say, AI. We've seen it. Some healthcare organizations have even had some of their nurses strike because they're nervous about how it'll impact patient safety or how it'll impact their jobs. People
Yeah,
are afraid to lose their jobs because of AI. Let's be real.
yeah.
And we have to, it's, I think it goes more into training because I
Mhm,
don't think that's going to happen. Maybe for some jobs, being realistic, but for the most part, number one, it can't because some of
mhm,
these policies that are coming forward are recommending that we have human oversight. Now is the time to figure out how will we do that. If we're
mhm,
using technology to aid in decision making and
mhm,
help with creating these workflows and things, do we have the doctor say, "Oh," or the radiologist, "I think it says this first," and then it's verified by AI? Or do we
mhm,
have I say it first, which may give some bias, and they say, "Oh, well, they said it, I said it." So those
mhm,
are the things that we're thinking through now. So
mhm,
how do we utilize these things to clear up some of these administrative things? Some
mhm.
of the hospitals are utilizing, like Kaiser, where they're helping take care of the inbox. Certain questions you can go through a decision-making tree to say, like, someone says, "Oh, I think I have a UTI." You know, you need a visit and you need some urine for that. So let them figure out when your appointment is so you won't
Right.
have your nurse doing that. So they
Mhm.
do things in the office. So
Yeah.
it's more about not being afraid of what technology is going to do to you or do to your
Right,
job, but
right.
how can we best utilize it to keep our patients safe, to
Mhm.
help reduce burnout and all of those things
I
so
love
that
that.
we can have a wonderful clinic that people want to return to every day. We have
Yeah.
a huge turnover issue in most of the places throughout the industry.
Mhm,
We have a worker shortage. We see that.
mhm,
We have too many nurses working in the hospital, seeing more than the amount of patients they should because there's
mhm.
no one else.
Yep.
We have physicians who are leaving the field, and we have so many different things. So how do we make work a delightful experience for those who we are having give up their lives? Like, in how many jobs do you have people who work 24 hours at a time or can't have to work the holidays? So there's so much sacrifice in healthcare. We should
Mhm.
bring some happiness to it. And I think that some of these digitally enabled tools will help with that. And then the ultimate goal is to bring some happiness and some health into our patients' lives. So we definitely have ways to do that. We just have to figure out how to merge that and communicate that and educate people and train them on how to use it appropriately.
Yeah, I like that. I never even thought about the context of how these digitally enabled tools can help to reduce burnout. It makes sense. It makes sense when used appropriately and when they're not, I'm going to say, when they're not weaponized by leadership, organizations, and even by the community. So there are some complexities to it, and there's so much hope and promise and potential. And I think what you said is so important that we lean in to explore, because if we're focused on the fear, then we don't have the capacity to explore how do we solve some of the problems that come up. We won't even see them because we're not leaning in to explore, well, how can these things be utilized? And then what we thinking through, what are the problems that could come up, or what are the problems that we've seen, or what are the myths, and how do we solve those problems so that we can maximize and optimize the use of these digital health tools for the good of patients and for the good of the people who provide the care.
Absolutely. Like, I'm sure you can recognize this too because we're both family doctors. And I don't know how many nights I did a full day of work and then I had to sit 4 or 5 hours after work or on the weekend to
Mhm,
finish notes. So
mhm.
there's an organization called Open Notes, and there are other ones. I don't want to
Yeah.
just like call out one, but they have the opportunity now where there's some kind of technology where as you're sitting in the room, it's recording the type of note. We call it, for those who are not in healthcare, a soap note, which kind of
Mhm,
goes through how we ask questions and how we formulate our thoughts to come up with
Mhm.
a plan for your care.
Mhm.
And so it's taking what you're saying and it's taking what the patient is saying too. So there are direct quotes. And it finishes the note before you're done, summarizes it, and both of you look together, and the patient can say, "Oh, I didn't really say that," or "I meant it in a different way." And your notes
Mhm.
down before you leave, and you're
Mhm.
able to figure out how to do more education or take more time and learn about their family or what's going
Yeah.
on. Because I don't know about you, but one of the reasons I went into primary care when I was in medical school, I had Dr. Sia. I'll give you a shout out, Michelle Sia. She's an OBGYN and she only saw women. So she called it like homegirl time. So every visit we were like, okay, what's our question of the day? And we would ask the same question to each woman and hear how they responded differently. Prince William and Kate got married and when I was in school, so the dress was there. So we're like, what you think of the dress? So you're able to do more of that and engage with your patients
Yeah.
and bring that joy back to medicine.
That's very cool. That's very cool. Yeah. Well, I think there's so much more to discuss and talk about in this. And, we could, like you said, we could talk for hours about this. It's just, it's, and for me, like I'm getting a lot of light bulbs and I'm getting a lot of thoughts around. I'm always thinking about collaborations and how, the work that you and I do are similar, different but similar, right? Like in terms of we want well-being for our colleagues and we want equitable care, and you come from this digital health domain, and then I come more from like the psychological safety and trauma informed, but they're integrally related, intimately and integrally related. And so I'm always thinking about, man, we've got some potential collaborations in our future, don't we? But I really do want to thank you for just the level of knowledge that you brought in such a short period of time, and I think that there's so much more to learn. I think maybe we might even have a part 2 to this, because I'm sure that there's more to talk about, the potential of digital health and all the ways that we're not using it that we could be, and all the ways that it could potentially provide better care or more equitable care, or reduce the harm for our patients and our colleagues. So, if there was one thing that you would want our audience to take away today, what would that be?
I think the takeaway point from this entire conversation is that we have to be open to change. We're
Mm,
in an age of what they call digital transformation. And
yes.
when you think about it, and I think this is like the synergy we were talking about with our work, it's all about transformation means change.
Yeah.
So being open to that. So when we were talking about the misconceptions, everyone's going to go into things with their different knowledge base and their ideas and their biases. Everyone has bias.
Mhm.
So how open are you to being receptive to learning new things and implementing that change?
Yeah.
That can happen with patients as they're adopting digital
Mhm.
health solutions, which can help them live healthier lives. Like you
Mhm.
want to change from your blood pressure being high to being normal. You want to change this to that. You want to get your mental health under control so you'll be happier. So it's,
Mhm.
it's about what will help you make that change.
Yeah.
The same thing goes for organizations. You want to improve healthcare outcomes, you want to decrease costs, you want to do all of these things so that you can set out to have your mission that most people are mission driven organizations. So, how do you implement that change? So, I think one thing I would say is keep learning questions. I have a resource for you guys in terms of my book, Risk Proofing Digital Health, a guide to ensuring quality and compliance. You can pick it up on Amazon under my
Mhm.
name, but it has some tactical ways that you can approach these discussions that we've been having, and even something, my scope framework of how we can go through and we can have systems improvement, compliance assurance, improve these outcomes with outcomes enhancement,
Mhm.
go through and you have this preventative risk management, because I think in healthcare we're very reactive, but we have
Yeah.
prevention, just like prevention in primary care,
Right.
how we can ensure equitable
Mhm.
outcomes. So that's all in the book. So you can take a look. One thing that I was really torn about as I was putting it together was, should it be very health carry and like medical leaves, or should I write it for the everyday person? So
Yeah,
I decided to go for the everyday person because number one, healthcare executives are not all physicians.
that's right.
And it may be helpful for people to just understand more about digital health and what risks are out there and how they can
Mhm.
utilize it for themselves and how they can advocate for themselves. So it's really a book for everyone.
Excellent, excellent. And we'll have the link to that book in the show notes in the description as well. And so that leads me to ask if people want to reach out to you. I know you work primarily with organizations. So if organizations want to reach out to you to consult with you, to have you speak, they want to connect with you on social media, what is the best way for them to do that?
I think the best way to do that is two methods. It's very easy to just email me.
Mhm.
Dr. Erkeda, DRERKEDA at drerkeda.com. If you want me to come, I do speaking engagements often. I'm actually on a speaking tour as we record this, talking about how we can risk proof digital health,
Yeah,
implement AI solutions, and mitigate bias. But I
awesome.
also speak to other organizations just on just overcoming obstacles
Mm,
because there are also barriers and to change. It's all about change management.
yeah.
So I love to talk to your organization. And if you're interested in any of the digital health consulting for digital health risk management,
Mhm,
you can just go to digitalriskcompliancesolutions.com.
mhm.
I'm right there. And I'm always on LinkedIn. It's my favorite form of social media. I have the others, but LinkedIn keeps pulling me in. So just
Yeah.
under my name, you can send me a message and I'd be happy to get back to you.
That's wonderful. Thank you for that. And we'll have all of that in the show notes as well. Well, this has been a wonderful conversation, knowledge filled. It's inspiring, right, to understand digital health and the potential that it has. And I just appreciate you coming on and gracing us with all of this knowledge. And so you all heard it, Dr. Erkeda DeRouen, and you have all of the information that you need. Go check her out at digitalriskcompliancesolutions.com. Get her on LinkedIn under her name and invite her to speak if you are a leader in a healthcare organization or any organization for that matter. If you're a startup, invite her in to consult because digital health is really the way of the future. You know, we are in a digital transformation, as you said. And so share this episode with someone that you know because it is important also on the patient side. Like as a patient, it's important to be literate about what the opportunities are for you being a full participant in your own health and well-being using digital technology. So yeah, share this episode and you all know how to get to me, mindremappingacademy.com. And I'm for all things culture and transformation, communication and psychological safety. So with that, and also, don't forget to leave a review when you listen to these episodes. And I tell you all this every single time. When you listen to these episodes, we want to know. We want to know the kind of difference that we're making. So make sure you leave a review and don't forget to like press that subscribe button so that you keep updated on when these episodes are coming out. So once again, Dr. Akita, thank you so much for being with us today. It was just such a pleasure. I am looking forward to our next conversation, which incidentally is very soon on your platform.
Yeah, we'll be having a LinkedIn Live where we'll be talking about all of your things and how organizations can do better with that. So I'm super excited.
Yes, me too. Me too. All right. Well, you all, thank you for listening because without the listeners, there is no podcast. You all have a great rest of the day. And until we see you again, stay empowered.